Thanks for watching the Medical Class 901 with Dr. Chi MD, an infectious disease specialist and professor of medicine in Memphis, Tennessee.
Let's go.
Welcome to Medical Class 901 with Dr. Chi. I am Dr. Chinelo Animalu, infectious disease and HIV specialist and a professor of medicine. So we have been talking about HIV, the effects in our communities here in Memphis, as well as all over the United States and the world. But there are other infections that are also plaguing our people that we need to talk about. And so today our topic is going to focus on other STDs or STIs, that means sexually transmitted infections, that are very common in our communities. And so we will talk about gonorrhea today. So gonorrhea, I'm sure every adult has heard about gonorrhea. It's the second most common sexually transmitted infection in the United States, and you have about 1.5 million cases every year. And what is surprising, actually, is that more than 50% of these cases you also see in the young populations from the ages of 14 to 24 years. And so that kind of falls in within our high school and college kids and young adults. So what is it? What is gonorrhea? How do we get this? So this is a medical class, so bring out your pens and your papers and you're going to take notes. All right, so let's start with gonorrhea. What is gonorrhea? So gonorrhea is a bacterial infection that is transmitted sexually and is caused by a particular bacteria that's called Neisseria gonorrhea. So the commonest mode of transmission is through sexual intercourse. It could be, vaginal, seminal fluid, where you kind of share, fluids, bodily fluids. And regardless of the mode, so it could be through vaginal sex, it could be through anal sex, or it could be through oral sex. So whichever way it is, it doesn't really matter. What happens is that if someone is infected, you can easily pass it on to the next person whom you've had some kind of sexual relationship with and is unprotected. So let's talk about the modes of transmission, okay? So how do we get it from one person to another? Like I said, you have to have been in a kind of, close relationship with somebody. It doesn't matter, somebody you're dating, you're not dating, but again, there has to be some kind of, exchange of body fluids, all right? And so the commonest question we tend to see is, okay, how do I know that I have this infection? Like, how would I know that my partner or, the people I'm involved with, they have this infection? Or how do I know that I, as Dr. Chi, do I have this infection or not? So here's the thing, okay? So this is one of those infections that we call a silent infection because it doesn't really cause issues. It doesn't cause a lot of symptoms. So almost 50% of these cases, remember we talked about 1 million cases diagnosed yearly, more than 50% do not even know. So it's mostly asymptomatic. What does this mean? It means that it doesn't come with symptoms. So it's gonna be so hard for you to know, right? So how do I know, Dr. Chi, how do I know that I have this infection? So there are a few symptoms that you might experience. So we're going to talk about what symptoms we see in females and what symptoms we're going to see in males. So let's talk about females, right? Okay, so you're having some vaginal discharge, something that is not normal for you. Remember that we know our bodies more than anybody else. So you can tell when something is not really sitting right, or you're having some abnormal bleeding or spotting when it's not your period and you're going to wonder like what's going on. Or you could have what we call urinary symptoms. These are things like dysuria. Dysuria means painful urination. You're not going to pee, but then you notice that it's kind of uncomfortable. You're having a little pain, and there could be some discharge, or you're going to the bathroom more frequently. And the commonest thing would be like, oh, maybe I have a UTI. If you are sexually active, then you have to get checked out by your doctor. It could be a simple UTI, it could be an STI, and gonorrhea would be one of the top two ones to worry about. So what about the male? What kind of symptoms are we going to expect in a male? The commonest one would be penile discharge. What this means is that you have some kind of whitish or milkish discharge when you try to pee, or you could also have some painful urination, and you notice that it's a little bit uncomfortable, when I go to pee, or you could have some swelling and pain in the testicle. The testicular areas. So when this happens, then you're worried like, something's not right somewhere. What do we do about this? All right. So what are the risk factors for gonorrhea? One, the major risk factors would be women under the ages of 25. This would be, again, like we talked about, we're looking at our teenagers, in our high schoolers, we're looking at our college students. So that's the highest risk where you're going to see that. And the second highest risk is going to be amongst, we call it MSM. It just means males that have sex with males. So those would be the highest risk factors for contracting gonorrhea. So now let's move on and say, hey, okay, if I have this, or if I have this suspicion that, okay, doctor, I have one of these symptoms, what do I do? Where do I go? It's so easy to diagnose. This is so easy to take care of. So what I would recommend you do would be to go to your doctor or the nearest health center, or somewhere, an acute cares, some kind of healthcare facility. And what happens is that there are two tests that we can do. One would be just a simple urine test, and we run it through a process. It's called the NAT test, the nucleic acid amplification test, the NAAT. And that is the quickest test, and it tells us immediately, if you have gonorrhea. If it's gonorrhea, it's going to show up there. And then your doctor is going to put you on antibiotics. So another thing would be, oh, okay, I can just take antibiotics. Absolutely not. Why? Because they're just specific types of antibiotics that would work for this infection. So let's say, for instance, that you have some, leftover antibiotics from your sore throat or something, and you decide, oh, okay, I have antibiotics, I'm going to take it. Is it going to take care of the infection? No, because there are different types of antibiotics. We have so many antibiotics, but they are just a specific group of antibiotics that can treat this infection. So we will go over to the treatment in a short while. Another thing I wanted to talk about, again, this will be to addressing women. So you can say, I've been in this relationship with this guy or this woman, or whoever, whatever it is, and how do I know? I feel like something is wrong somewhere. Maybe I have some symptoms, but I have not stepped out of this relationship or whatever. So in real life, you can only vouch for yourself. I'm not saying there's anything wrong with your partner or whatever, but once there's something, you feel like something is not right, or you notice that in your partner, maybe there's a rash, maybe there's a wound, an ulcer, or there's some discharge, something is not right, then you guys need to get yourself checked out. Mind you that if you have this infection and you have unprotected sexual intercourse, you would definitely pass it along to whoever it is, be it one partner, two partners, or whatever. Risk factors, another major risk factor will be multiple sexual partners. So this show is not about, telling you what to do, it's how to stay safe and how to keep your partner safe. So we're going to take a short break. When we come back, we will continue, and we're going to take questions from the audience, and then we will talk about treatment and what to do when you are diagnosed.
Thanks for watching the Medical Class 901 with Dr. Chi MD, an infectious disease specialist and professor of medicine in Memphis, Tennessee.
Let's go.
This is Dr. Chinelo Animalu, the host of Medical Class 901 with Dr. Chi, and this is the show that talks about the major infections that plague us here in our Memphis community. So please make sure you tune in every Sunday at 6:30 to get a glimpse of this class. See you then. Welcome to Fun Facts with Dr. Chi. I am Dr. Chinelo Animalu, Infectious Disease Specialist and Professor of Medicine. So we're going to talk about just some basic points to know about HIV. So what does HIV mean? Human immunodeficiency virus, which is a virus that we can pass from one person to another through sexual intercourse, or sharing body fluids, or through blood transfusions, or by sharing needles. About 39 million people are affected worldwide, and it's a major cause of mortality in the world, meaning death. It causes death. And the end part of HIV is called the AIDS, and this means somebody that has untreated HIV infection, and this would have run for many, many, many years, and sometimes some decades. You do not get HIV from kissing, from hugging, from sharing utensils in the households with people. You don't get HIV by saying hello to anyone. Welcome back to Medical Class 901 with Dr. Chi. I am Dr. Chinelo Animalu, Infectious Disease and HIV Specialist and Professor of Medicine. So today we are talking about gonorrhea, the second most common STI, meaning sexually transmitted infection that we see here in our communities, not just in Memphis, but all over the country as well as all over the world. So we're going to start this segment by taking questions from the audience.
So how would I know if I have gonorrhea?
So that's an excellent question. Sometimes it's so hard to know because, like I said, majority of cases are asymptomatic, meaning that you actually do not have any symptoms. And from the time, and you don't have any specific time period where you're going to say, oh, in 3 days' time, you're going to have symptoms. So it can range from the time that you were exposed to, perhaps someone that had the infection and did not know they were infected. It could take anywhere from 7 days up until 3 months. And, when you have those, you might have a little, mild symptoms like talked about that you could think, oh, maybe I'm just having a UTI because, you have some pain with urination or you have some pelvic pain and you might think, oh, my period is coming or something. And then it goes away, right? And then it lays there. So you don't even know, for most times, most period, you don't even know that you had this infection. And that goes for whoever your partner is. So it's not like for most times, oh, I'm trying to infect you. No, they do not know. It could be something that you contracted 5 years ago, and now you are in a new relationship and, somehow somebody's manifesting. And so, I can see how this would be a problem. Oh, did you cheat on me? Oh, you did not. Oh, hell no. How did this happen? And I just want you guys to know that, again, it's not something that perhaps happened immediately. It could have been something that you were exposed to years back, but just laid very silent. So it's so hard to know, but what I always tell people is sometimes your body will always tell you that something is wrong somewhere. For women, if you start having discharges, if you start having pain during sexual intercourse, if you start noticing that you're having spots of bleeding, it's not your period, something's off in that genital area, please go get yourself checked out.
Hello, my name is Angel. I am reaching out to share my story about HIV. I never knew I could get HIV by having unprotected sex. I am living with this nightmare due to a bad decision that I made one night. There is no cure for HIV, and even though some medicines are available, my advice is to never have unprotected sex with anyone. My question to all young people in the nation, is one night of sex worth dying for? Take it from me, No.
Next question.
Dr. Chi, what if I was pregnant and pregnant women are not allowed to take medication, and do I carry it throughout my 9 months, and will it affect my baby?
That is a very deep question, and thank you for bringing that up, because this is one of the major complications that we see in gonorrhea when you have this infection in pregnant women. So gonorrhea can affect a pregnant woman, just like any normal thing. The bacteria is not going to ask you, are you pregnant, are you not pregnant? It will affect anybody, including pregnant women. And this is so important. Why? Because the pregnant woman who is untreated is going to transmit this infection to the baby. We don't want that to happen. And so what happens is that this child comes out. Complications will include things like blindness, things like meningitis, meaning the infection goes to the brain and will either kill this child or cause damages to the brain cells, and then you have an abnormal baby. It can also cause what we call sores or ulcers all over the head. So for pregnancy, the good news is that here in the United States, and hopefully in major parts of the world, at least the developed parts of the world, if you are getting your prenatal treatments or care, they will always check you for things like gonorrhea, for chlamydia, for syphilis, and if you test positive, they're going to go ahead and treat you. Now, what happens to women who, for some reason, did not get prenatal care, meaning that they never, followed up with their OBGYN or established care with their primary care doctor or OBGYN to care for that pregnancy, and therefore they were not tested. So there is something that the government, US government, has in place. I'm sure you guys, anybody that's had a baby would notice that when you give birth, for every child born in the United States, they are going to put some ointment in their eyes. It's called erythromycin ointment, this, a type of antibiotics. And what that does is to prevent that child from picking up, be it gonorrhea, be it chlamydia, whatever sexually transmitted infection that the mother has. And so that would be a way, this way, it kind of covers everybody, whether you got, you followed up with your OBGYN, you got prenatal care, or you did not. So that's kind of a safeguard that's been put in place by the government to ensure that every baby that is born, at least majority of the babies that are born here in the United States and all over the world, receive prophylactic care. And, and then they go ahead and treat the woman, obviously, if, subsequently they find out there's evidence that she had this infection. So this is something that's very important for every pregnant woman. I'm sure, as mothers, we do not want to transmit any infection to our baby. So even if you're not doing it for yourself, you're going to do it for that unborn child, okay? So that's something I really, thank you for that question. So hopefully every mother pay attention, get your prenatal care if you're pregnant. And they're not just gonna check you for gonorrhea, they will check you for other STDs. We talked about syphilis, we talked about chlamydia.
Lamar Productions presents Let's Talk 901. Focused on health and social concerns. Top doctors committed to infectious diseases. Doctors on the next level of education. Memphis, the medical home for top doctors. Next level research and technology. Renowned doctor and professor of medicine. Medical Class 901 with Dr. Animalu. Memphis, the heartbeat of 901.
Any questions? Any more questions?
Yes, thank you so much, Dr. Chi, for this show. It's so informative. My question about gonorrhea, is it true that if a woman have gonorrhea and is left unchecked, that it can cause infertility or cause her not to be able to have babies?
Oh, absolutely. Excellent question also. So let's talk about the complications of gonorrhea. So I'm going to go ahead and address that. So yes, absolutely. That when a woman has this infection, especially if you are in the childbearing age, one of the commonest complication, if not the commonest complication of gonorrhea, is what we call PID, pelvic inflammatory disease. And so this is where you have, we call it an ascending infection, where it goes from, the vagina area and goes all the way to the cervix, to the fallopian tube. And so your entire system as a woman, reproductive system, has an infection. And usually when that would be like the, long-term sequelae of this type of infection. And usually this person is going to end up in the hospital because it's going to come with severe pain. It's going to come with fevers. You will know immediately that something is terribly wrong. And what is the complication of PID? Infertility. How does this happen? Because this infection kind of messes up with the fallopian tube. And so the fallopian tube is the tube where they, like if a woman is pregnant, where the eggs travel up to, and all the way to the uterus and all that. So they get inflamed and then blocked. So that way, that woman is said to be infertile. She's not going to be able to get pregnant and carry that baby on her own because now you have damage to the fallopian tube. Another complication that you will see in this infection is ectopic pregnancy. Ectopic pregnancy is when a woman gets pregnant, but instead of the fetus to embed in the uterus, it goes and embeds in the fallopian tube, and then it ruptures. And it's a terrible thing, because at the end of the day, to save the woman's life, they're going to have to cut off that fallopian tube or have to do major surgeries. So you can see these are all the long-term effects of having untreated infection. So the question now would be, what do we do from here? Now you have this information. What are you going to do? If you are sexually active and you are not using protective measures, things like condoms or other barrier methods, then you have to get yourself checked. The CDC would recommend, if you're up to 25 years or so, go ahead once a year and have yourself checked out for, get these STD panels. We have places around in our city of Memphis, as well as other cities, where they offer free check-ins. So I don't know, some healthcare, some clinics, you can go there, that's run by the state, that's run by the government, and you don't have to pay anything, and they can run a full panel of STIs, that's sexually transmitted infections. This would include things like HIV, herpes, which we would talk about in a different show. HPV, the HPV you have to get from your OBGYN doctor. That would be a different topic on its own. Gonorrhea that we're talking about, and then things like chlamydia.
Hello, my name is Angel. I am reaching out to share my story about HIV. I never knew I could get HIV by having unprotected sex. I am living with this nightmare due to a bad decision that I made one night. There is no cure for HIV, and even though some medicines are available, my advice is to never have unprotected sex with anyone. My question to all young people in the nation, is one night of sex worth dying for? Take it from me. No.
Thanks for watching the Medical Class 901 with Dr. Chi MD, an infectious disease specialist and professor of medicine in Memphis, Tennessee.
Let's go.
This is Dr. Chinelo Animalu, the host of Medical Class 901 with Dr. Chi, and this is the show that talks about the major infections that plague us here in our Memphis community. So please make sure you tune in every Sunday at 6:30 to get a glimpse of this class. See you then. Okay, we have time for one more questions from the audience.
Okay, now Dr. Chi, we all know that, children that may be sexually active, as you said, at a young age. They don't call home to ask for permission, right? They just do it. So what would be the best way for a parent that don't know their child is sexually active, that may have been infected? What do you propose for those parents, if they even think or not that their child is sexually active?
So that is a very deep question. it's, in the way we were raised, is completely different from how, the kids these days are. They do their own thing. And what you said is absolutely true, because most parents do not even know that their young teenagers are sexually active, and they don't ask for permission. So the first thing, one of my famous quotes is, "My people perish for lack of knowledge." So one thing that's very important is to actually sit down with your teenagers and have this talk, regardless of if they're sexually active or not. It's a very uncomfortable conversation to have, but it's something that I do encourage all parents to do. I have a teenage daughter, and I try to sit her down and have this conversation, and she's like, "Mom, kill me." Like, they don't want to hear it, okay? But we have to let them know, because at the end of the day, these are things that would destroy their lives, if not kill them. So kids, what I'm going to say to our teenagers out there, to our high schoolers out there, to our college kids out there, even if you don't want your parents to know, you should still be able to go into one of the free clinics and still get yourself checked if you are having unprotected sexual intercourse. Again, it doesn't matter if it's oral sex, if it's the normal, vaginal sex, or, anal sex. It doesn't matter the type of sex it is, as long as it's unprotected and there's exchange of bodily fluids, you are at high risk of contracting this. And again, you can imagine something that you contract when you were very young, and now, you're grown, you're married, you want to have kids, and the doctors are, "Oh, your fallopian tubes are blocked." And you can imagine how devastating that is. So even if you don't want to discuss this with your parents, you should still, check out those sites that offer free testing, and take yourself and, hopefully convince your partners and have you guys tested. It's always good to do that background test at first. So, let's say you're going into a brand new relationship with someone or some people, know your own status first. Make sure you don't have any infection. Like I said, this is one of those infections that doesn't really come with lots of symptoms, so you wouldn't even know majority of the time that you have something. So check yourself out, and then your new partner, find a way to convince them to, both of you go get tested, prior to, even starting anything deep. So both of you will know what your status is. Anybody that has any kind of infection, you take care of that. If you are close to your parents, you can have that conversation, but parents, they much of the whole thing lies on us as mothers, as fathers that are raising young kids in this generation, in this age. Be the one to have that uncomfortable conversation with them and keep them safe. This is Medical Class 901 with Dr. Chi, and today we talked about gonorrhea. And on our next episode, we will address chlamydia. So thank you for joining us today. Please make sure you check us out on our social media. You're going to see the links downstairs, and we'll see you next time. Bye.
Thanks for watching the Medical Class 901 with Dr. Chi MD, an infectious disease specialist and professor of medicine in Memphis, Tennessee. Be sure to subscribe to our YouTube channel, Medical Class 901 on Facebook, and connect with Dr. Animalu on LinkedIn. Dr. Animalu's goal for Medical Class 901 is to bring awareness and prevention to infectious diseases plaguing the Memphis and Mid-South communities.